feel like people off.
Yeah.
Okay, what's your name?
My name is Pam Terrison, and I have a Bachelor of Science in Physical Therapy.
Can you tell me about your experience with continuing education?
Yes, I've been involved in continuing education as per our state licensure ever since I got out of physical therapy school. But my biggest continuing ed thing I did right after I got out of school was to get certified in beginnings spinal manual therapy. And then I have just continued with lots of other courses that just helped me in my profession since then.
Okay. So what are some of the things that you've learned, or do you feel like the continuing ed has really helped you treat your patients?
Absolutely. I love the manual therapy things that I learned, but I've learned lots of other things along the way. Myofascial release things, lots of hands-on things. I recently took a rotator cuff repair course, and it would just help me because I just recently got a rotator cuff repair patient on my schedule. And then I have also taken core strengthening things, which have added to my treating people or working with people and teaching them Pilates. And so that was nice to have the physical therapy perspective on the core strengthening as a Pilates instructor as well. And then recently I took a course that I haven't gotten to use yet that was kinesiotaping, and I can just see really neat applications for it, although I haven't gotten to actually use it.
Okay. Can you tell me a little bit about the accreditation of these courses?
Yes. So the courses that I have taken are usually either accredited, pre-approved by the TPTA before I ever even sign up for them, and some of them have just submitted for approval. I learned the hard way that I need to make sure that they are approved already, because a couple years ago I had to get one course that I took approved by the TPTA, which was not a huge deal because the course had been approved prior to my taking it on that renewal cycle, but it was a little bit of a hassle. Okay.
And then, can you tell me about how this fits into your schedule, because you're not just a physical therapist?
No, I have been fortunate to be able to take a wide variety of courses since I took time off to raise my kids, but I still wanted to keep my PT license current. So in keeping with getting the 30 hours every 2 years, which is what we need for Texas, I took courses that weren't necessarily huge physical therapy courses, but things that I just really wanted to learn about. Like I took a course on allergies and asthma in adolescents, and I took courses on nutrition, which I just thought would be a general help for raising children and just also in my personal life.
Okay, and so do you feel like continuing education has helped you be a lifelong learner?
Absolutely, because I've always loved to learn anyway, but I don't know if it wasn't required for me to take 30 hours every 2 years per the Texas Physical Therapy Association, or the TPTA, just to keep my license. I don't know that I would be so diligent about it, but I do love to learn.
Okay, so it kind of provides an avenue for you to learn about some things and stay current, and without, and it gives you a framework for what you need to be learning. Right?
Absolutely, absolutely.
Okay. Okay, thanks.